Hi, I'm Dr. Cyrus Thomas. We are combining two shows today. We're combining nutritional medicine and chronic ailments with Janara Iman, a nutritionist. We're going to be talking today about testimonials and ailment types. In other words, we'll mention an ailment, we'll talk about how that ailment usually progresses when we start to treat it with natural nutritional medicines. Janara, glad you're here today.
Hi, nice to be here.
Sharing this show with me.
Yes.
We're talking about testimonials. When we talk about gluten, we can talk about a lot of different people.
Yes, we can. And the interesting thing about gluten is that only about a third of the people that are sensitive to gluten really have any symptoms. Although we're going to talk about it later, we're going to show a slide showing exactly how many symptoms there really are. There's still a lot of people that get none at all until they're full-out celiac, and we'll be able to talk about the difference in that. But if you noticed in your practice, people come in and say, I have gas, I'm bloated, I eat really a healthy diet as far as I know, I follow the food chart, I don't eat junk food, and yet I always have stomach distress, I have a feeling of bloatedness, gas, and sometimes I have diarrhea or constipation. What is that all about? What's wrong with me?
Of course, sometimes it's parasites, sometimes it's enzymes, sometimes
Right.
it's as simple as gluten. Jim Annette, who did the Perfect Health Diet, referenced a study that was done where they did a scope into people's intestines and they did a visual on what happens when people eat gluten. 83% showed visual inflammation. Even though only 0.5% of the population has celiac, 83% were showing a sensitivity to gluten. So it looks like, since we've been eating wheat and other grains for about 6,000 years, that our time is up with grains. What do you think?
Well, I don't know, I'm not really sure if I understand what you mean by our time is up with grain. But perhaps what you're saying is some of us just haven't developed the ability to be able to utilize it correctly, or get past the inflammation and the lectin response. Or in other words, to some of us it's toxic because our ancestry doesn't have enough time to evolve to make the enzymes to fully digest it. And in addition, in this day and age, we have exacerbated the problem by the overabundance of gluten in everything and the hybridization of grains to the point to make them have more gluten so that our bread can be softer and doughier compared to the past. And our bread is made in 7 minutes now instead of hours of like the slow chemical process that eliminates quite a bit of those toxins.
Let's say you have somebody come in with stomach pain, vomiting. We can go to camera 2. Stomach pain, vomiting, reflux, constipation, loose stools, bloating, itchy skin, dermatitis, herpetiformis, or maybe no symptoms at all from gluten. That's different than celiac. But say somebody comes in with this and you put them on a gluten-free diet. What can you expect to see as time goes by?
Well, almost within a week or so, you automatically get the response, or at least I have in my practice. I feel so much better and I'm losing weight. Often there could be extreme stomach distress and it won't affect the person's weight at all, but if a toxic buildup also creates an excessive weight gain. And so immediately people have less stomach distress and they tend to lose weight, which is really interesting.
Right.
What about you? Have you found that to be true?
Yes, I've found it to be true in myself as well. When I dropped eating a heavy grain diet and got rid of gluten for the most part, I didn't have as much abdominal distension. I also noticed that there was less gas formation.
Yeah.
And the bowel movements become regular, and you can actually eat more dense food that way, because when you're eating floury products, you're filling yourself up with pasta and breads, and they're not very dense, nutrient-rich food.
Yeah, very true. I agree with that. And you know what else? The adjunct to that is that all of those grains turn to sugar very quickly. So then they affect our glycemic levels or our blood sugar levels, and we're going to talk about that later.
Tell us about this slide.
Well, this slide is interesting because all the research has been done on gluten, which is actually a protein, and in wheat it's called gliadin. But one of the things that we haven't really touched upon a lot in the States is that rye, barley, oats, sorghum, millet, teff, and corn all have these so-called prolamines, but they're different. And some of them are glutinous and some of them are not. So the ones down here in green for sorghum, millet, and teff, and corn, they don't have a large amount of gluten in them. And their prolamines are caffeins and zein. And oat is another one. I have it in brown here on this slide because this adenine is less irritating to the bowel. But these red ones.
If we can get a close-up on camera too, we'll see that in the left column are the different types of grain, and in the right column are their prolamines.
And what happens is these prolamines here are hard on the digestive tract. So by the time they get into the small intestine, those little villi that are very, very important.
We're going to see those in a minute.
We're going to show those. They get sandpapered down, by these grains.
So wheat has gliadin, rye has secalinin, barley has hordein, oat has avenine, sorghum, millet, and teff have the caffeins, and corn has zein. So this would explain people having food allergies as well.
Well, it does, because if you can't digest these proteins, they go into the blood undigested, and then they create a histamine reaction. And over time, the body remembers that, and it'll create a histamine reaction time and time again. To the point where
you end up with too much zonulin.
Well, okay, here we go. That's another topic. You do, but not for every food allergy. And we got a little picture up here that's really nice. It's a picture of an enterocyte cell. And as Dr. Cyrus pointed out, zonulin is a real key to this, because gluten and leaky gut and food allergies all have something to do with something called a tight junction. These little guys are supposed to be tightly put together. And
with the junctions, we can see them there.
And that keeps
this
food.
One doesn't have a junction.
Right, and so that those junctions keeps food in the small intestine, and these enterocyte cells are in the colon too. They just act slightly differently. But
it keeps it from getting into the blood.
Well, here's what happens. The zonulin creates the space. And people with celiac have 3 times the amount of zonulin when they're tested. And there we go. We want to be tested. We want to know what's going on, because if we have leaky gut, that could be the problem. Maybe not even gluten sensitivity in the same way, or celiac in the same way we think or we're thinking about. But so you can take this test. We can test you for this leaky gut. And if you come out negative, we can say, okay, let's go to the gluten sensitivity. We'll give you another test. And so by testing, we can tell exactly what is causing your tight junctions to separate. But zonulin is the thing that makes the spaces. And then when this food is in your intestine and it's not digested well enough, these proteins can escape before they're ready. And that's why, unless we test you, you can't tell whether or not it's gliadin, gluten, or
right.
other kind of food allergies.
So you might tell a patient who comes in who has these kinds of problems to expect 3 to 6 months.
For healing?
For starting to see change.
Well, really, most people feel it right away, but for healing, yes. For healing, that's it. That's what we would expect.
And if you've got this for long enough, this person is certainly going to have chronic fatigue. Now, when somebody comes to me with chronic fatigue, I might tell them this could be 3 months to 2 years as far as a project goes for getting healthy. It's not like go to the doctor, get a pill, feel better in 2 weeks, and you're good.
Exactly. I couldn't agree with you more, because chronic fatigue is something that happens over long-term inflammation. And it could be longer than that even to feel better, because the chronic fatigue syndrome is where we get to with long-term chronic fatigue. So you can see where we're going. We like to work preventively, and I know you do in your practice as well.
My blood work and physical exams look normal, but I am not functioning well, the patient says. The medical profession claims there is no cause and no cure of chronic fatigue, and that it's a bit in your head and maybe you should go see a psychiatrist. Well, I'm treating 2 psychologists right now, and what I tell them, they know it's not in their head. They know
Yeah.
they know what's in their head, so they know that they have physical problems, and physical problems cause emotional problems, and along with that comes fatigue and overwhelm,
Right.
and the stress and anxiety that comes with fatigue. What is pre-diabetic?
Well, pre-diabetic is hyperinsulinism, and when your body is creating too much insulin from an overabundance of sugar, regardless of whether you're eating sugar or you're just eating foods that convert to sugar very easily. Now, I have patients in my office who say, "Oh, no, I eat healthy whole grains and I eat, only whole wheat bread or whole wheat pancakes and everything is made fresh." Well,
carbohydrate.
these carbohydrates, especially if there's not enough fat in the diet along with it, break down to sugar very, very easily. And the inflammation process begins. So
here we are.
Here we are at the cellular level.
Inflammation.
Yeah. Here, even Time magazine recognizes it. When we start seeing it in the public headlines, we know, okay, we've got some backup to what we're saying now.
When you see it in the public headlines, you know that nutritionists have known about it for about 30 to 50 years.
Yeah. And finally we're making an impact. I've been practicing nutrition for over 30 years, as you have in your clinical practice. And these are the things we know, but we have a hard time impacting our patients because they have so much access to information that's conflicting. And so, when your inflammation becomes chronic,
rather than transitory,
yeah,
the body turns on itself with after effects that seem to underlie a wide variety of diseases. So we have to go back. So there isn't just going to be a pill for inflammation. Your C-reactive protein is probably going to be up. Your enzymes might be okay. They might be digesting the food, but you can't absorb them because you have a lining to your intestine that's trying to protect the intestinal wall from the inflammation called biofilm.
Yep.
That needs to be taken apart and removed, but not until the inflammation goes away. And do you think the fastest way to remove the inflammation is to remove the gluten?
Well, I think it's one of the fastest ways. Also the sugars, the excessive sugars. I mean, let's just clean up the diet because part of this is also toxins. And we get a lot of toxins. We have lead, that's in milk and bread.
So we do hair analysis, which we'll be talking about.
Yeah.
Why do you do this test for malondialdehyde?
I say it differently.
Malondialdehyde.
I say malinaldehyde.
Malinaldehyde.
Yeah, I know. It's a great test, and I do it because it takes 5 minutes. You can do it right in the office, and you have the results immediately. And what it does is it tests the lipid peroxidation and free radical damage in the cell. We just showed you the cellular inflammation slide because you want to know how bad and how fast this is happening because this is how we get chronic fatigue. This is what feeds the inflammatory response that leads to the underlying cause of most disease, and this is a 50 times more accurate than most testing methods. So
not testing methods such as a regular blood test, but this particular method is 50 times more accurate than testing it in the blood in a blood test.
In a blood test, yes, so we want to do it with the blood work, and so a lot of times when you're going to go get your blood work done, these kind of tests are not combined into the total picture, and we want to know what this lipid peroxidation level is because this is how we're going to get rid of inflammation in the cell. And it's so important that our cell is making enough ATP so that we have the right amount of glutathione so we can detox.
So by measuring malondialdehyde, we're actually looking at how much free radical issues we have to deal with.
You bet. And then we can go to dietary supplementation with antioxidants and different antioxidant types foods to support that as well.
So before inflammation was the big thing, hypoglycemia was the big thing a few years ago, but it's still going on. We saw a television program that said that each day in the U.S., more soda is drank than
it's a
beer,
scary thought.
Coffee, and water, and bottled water combined.
And it's
more
frightening.
Soda.
More soda, and especially the diet sodas, which has the toxins, like we were just talking about. And for everybody who doesn't believe it, go look up aspartame and find out read the thing about how it turns to formaldehyde and wood alcohol in your liver, and then you might not be so happy to go grab it so quickly.
Right,
You know.
which they even thought that the war syndrome, when the
Gulf
soldiers
War
were
syndrome,
Gulf War syndrome,
exactly.
was that they were drinking Coca-Colas over there, Diet Cokes, and the aspartame was turning into formaldehyde, making them go half crazy,
Exactly.
thinking they're going crazy, actually going crazy from the formaldehyde.
Exactly.
A simple cure.
And it is simple, and people don't realize that it starts to turn to formaldehyde at body temperatures. So when they were sending it over there, it was reaching the temperatures of 120, then it was thrown back into the refrigerator. It was already starting the process, then they were drinking it. So it's pretty sad, when you think
Look
about
at this girl wiped out on her computer with her earphone on and her cup of
Right.
coffee. So if we keep doing sugars over and over again, the pancreas has to keep adjusting to it
Insulin.
with insulin.
Yeah.
Every time we make insulin, we take our foods and turn them into fat and store them in our body
Exactly.
because our body thinks we're starving. So then we've got an obese America, we've got an obese Mexico, Europe is getting
Yep.
obese, China is getting obese. My God, the whole planet is getting obese, and is anybody really talking about it?
Well, they're talking about it a lot, but not maybe in the way that we should be looking at it, because we're still fat phobic. Still, if the number one cure, if you're going to be talking about this, because I study diets all the time, and the dietary programs say to reduce serum cholesterol, do not eat fat. And there's a lot of doctors that have a lot of clinical studies. There's Dr. Neal and his vegan diet, But I don't mean to interrupt you. I wanted to give you a clinical study that he
Don't
did.
get me going on vegetarianism and fats, because it's become pretty clear that natural saturated fats in well-produced animal products is a good thing for the body. I was looking up a drug yesterday and reading about it. It was given to a 92-year-old patient for diverticulitis, and it said, do not give the patient probiotics because we don't have any good studies to support it. Well, we don't have any good studies to support it because it sells for cheap. It's in the health food stores. Who's going to pay for all those studies?
I have
You
a
can't
case.
get a patent on it.
I know.
Nobody's going to study it.
I had a patient who was a nurse who tried every medicine on the planet and said, what the heck? And I put him on a heavy regime of probiotics and aloe vera, along with some other things, But I had his blood tests in front of me. But that alone, he said that the minute he started taking the probiotics, he started feeling better. And he
Sure.
had full-blown diverticulitis.
Well, there's a good testimonial right there. What do we mean medical analysis, nutritional treatment? Medical analysis.
Oh, we really love the science of medicine. We love the testing. And now we can be holistic practitioners and have science backing us with all these great methods of testing. And we can take it a step further. We can do the testing in a way where we have these lab test results that are based on healthy people's lab scores rather than a whole group of sick people.
So if we're looking at results that are between the dotted lines, we're really looking at about the last 10,000 sick people to go into that lab, and what they consider to be an average amount of the substance you're studying. What do I care what 10,000 sick people are reading in their blood? We use a more strict, narrow range.
Yeah, and so the mean average of those sick people's ranges begins to create lower and lower scores for acceptability. And so we call these functional highs and functional lows, where actually what we really want is we want to know what makes us function at our peak optimum level.
And a lot of people will come in this range, so a number of values are here, a number of values are here.
Right.
I don't feel good. My doctor says everything is fine. It must be in your head. Go see a psychiatrist and get some psychotropics.
Exactly, and that's common.
We do a 52-element blood test. And you talk about this on your show, Chronic Ailments. I talk about it on my show, Nutritional
Correct.
Medicines. And in the 52 elements, we're looking at cardiovascular, kidney, liver function, thyroid function, white blood cells, red blood cells, all of the elements of the immune system, the different types of white blood cells, breaking them down. We color code them for how far off of normal they are. Normal gets a green star. A warning is yellow, a risk is red, and a code blue is blue. So this person had a number of blues and a number of reds, but in about 5 months, things came out pretty nicely. So we can take a patient, put them on a nutritional program. Sometimes we have to adjust it as we go along, but then when we do the retest, we see that they've done better.
And I consistently look at blood work. That's done, just from the average lab report without the combination of the way we do it. And I don't really see the same level of improvement without the nutritional support and the wisdom behind the thousands of people that have put these nutritional protocols together.
Well, what we do is we send the results of this blood test to a large computer in Dayton, Ohio. They compare these tests with the tests of thousands of other people who have done the same test, but who are taking nutrients to get better.
Correct.
Right?
Right.
So you're not comparing it with Joe Blow, who's doing his psychotropics and drinking 3 martinis at night.
Poor guy.
You're
he's having a good time,
he
though.
thinks he's having a good time. You're actually comparing them to people who are more involved in health and lifestyle.
Exactly. And I think that quality of life is what we really want to talk about here.
So there's a number of elements to this. Right, quality of life. Okay. Yeah. All right, to get a quality of life, maybe you have to do a hair analysis.
You want to do a hair analysis.
Because you've got an artery and vein go into the follicle. The entire shaft of the hair is made up of atoms and molecules that come out of the blood.
Yeah.
People don't realize that.
They don't.
Where'd your hair come from? Well, I don't know. It just kind of comes out of my head. Well, every atom in your hair came from your blood.
Exactly. And it is one of the greatest outflows of detoxifying the body, and people don't realize it.
The body can use the hair to get rid of things it doesn't want. It contains minerals, essential elements like copper, chromium, iodine, sulfur, iron, 22 essential items that you need. So we're not only looking at things that the body's trying to get rid of, but we're looking at things that you already have, that you need, and that need to be in a certain ratio.
Exactly. And so that's important.
So a hair analysis is good to find the toxins like lead, mercury, arsenic.
And it's also good to find out what minerals you're missing, because this is really key as far as even absorption and being healthy at a cellular level.
Why do we measure cancer markers and most physicians don't?
Well, I don't know. I can't really say that most physicians don't, but they don't unless you ask for them, and they have to justify them. And for one, many insurance companies, they don't justify it unless there's a code, a medical code, saying there was a need.
No, it's unless there's already a tumor.
It has to have a pre-existing condition, or it's not covered under insurance, and so doctors tend to not do it unless they actually see a problem. But you and I work from a preventative level, and we can include this in our testing methods, because we do such a large blanket of testing at one time to get a biochemical picture of somebody, that we can look for these cancer markers ahead of time and say, let's deal with this before it becomes a problem.
So I think a lot of doctors, pharmaceutical prescribers anyway, don't want to do cancer markers, because if one of the markers is high, the patient will say, oh my God, I have cancer, I better go see an oncologist. They disappear. The doctor says, I lost my patient.
Oh, yeah.
If he hadn't have done the cancer markers, they wouldn't have gotten scared, they wouldn't have left. What we have to tell them is, we're going to do a cancer marker. If it comes back high, I don't want you to think you have cancer. I want you to think you might have cancer, but you might just have a lot of inflammation. Because these markers measure inflammation as well as they do cancer.
Well, we all have a certain amount of cancer cells. And it's how our immune system is working and how our cells are functioning and what our inflammation levels are. So whether we turn these markers on, because we've done so many studies on the gene and the genome now, we know, that epigenetics affect a lot. Our environment affects whether these markers get turned on or off, and that's mostly with our diet and what our stress levels are.
So by doing the urine analysis, the blood test, the hair analysis, the questionnaire, putting that information all together, sending it through the computer in Dayton, Ohio, comparing it to thousands of other people, getting a 15-page report back. We've looked at cancer markers. We're looking at their blood as compared to a healthy range, that more narrow range we talked about. The lab tests have been compared to other people. And when they do a follow-up study, the new results get laid in parallel to the old results, color-coded, so we can see exactly what has happened.
I know, we
think
can
it's
see where the
state-of-the-
improvement are.
It's
Yeah.
state-of-the-art medicine.
It's state-of-the-art medicine. I think you went backwards there. There we go.
We have two of those. In the hair analysis, we're looking at the heavy metals here on top, and we're looking at the essential elements on the bottom. It's rather complex, and we're graphing all of these to know exactly what's going on. If we find a lot of heavy metals, we do oral chelation, meaning you can take pills orally
Right.
to help drive the metals out of the body.
And we're very good at that. We know, and we love the fact that we're getting these nutritional recommendations by computer rather than standardized medications.
Summary of a perfect health diet. 65% plant, 35% meats and oils. You okay with that?
I'm okay with that. That's how I eat.
That's by weight,
Yes.
not by calories.
Exactly. And so we're looking at percentage, and
So
I
how
eat
come
that
you're
way.
so slim and I have to watch my weight, and yet we both eat the same?
I can't answer that for you on television, but
So what well, I figured what you would say would be that, not that I like flan, but rather that there's different constitutional types, and some types have an easier some types have an easier
Exactly.
time staying thin than
well,
others.
there is. I mean, I work with that too because I work with a lot of Eastern philosophy, Ayurveda, and 5-element in food. And I look at constitutional types very, very closely, as well as hormonal body types. And the way that you put on weight is where your hormonal disposition is, which we can also test for. But also, it can tell us how you metabolize sugar, and I can adjust your diet and my patients' diets depending on this constitutional type, which is the ancient wisdom, versus what their blood tells me. I can say, okay, I'm
So
right.
you're using some Ayurvedic typing, you're
I
using
am.
some homeopathic typing.
I am.
You're using an endocrine gland method
Yes,
of
I am.
typing. Nutrition is smart medicine, so I'm afraid I jumped by. This is our office on D Street. My website is Integrative Alternative Medicines with an S.info. Janara's website is vitalnaturalhealthsolutions.com. I'll leave those up there in case you want to write those down. Last thoughts for the people watching in a few seconds?
Well, I think that one of the things I want to say about our passion about health, we really want to be working on a preventative level. We really want our patients and those who we work with to feel like their life has vitality. And the way we get past these fatigues and these inflammations is to work with the scientific discoveries that we make with the combination of testing we do, along with diet and nutrition, and we get amazing results. And I have a passion for that because it's really exciting to see people get better.
Right. My phone number, 847-5020, Janara's 496-5205. Want to thank you for watching the show today. Janara, thank you for being on the program.
Thank you.
We air on Tuesday evenings at 8 o'clock and Saturday
Saturdays?
afternoons at 2:30. May you be in good health.